Hello, I am Carole Malone, Assistant Secretary of the Massachusetts Executive Office of Elder Affairs. It is my pleasure to welcome you to this episode of Senior Scene, a program for older adults living in Massachusetts. The focus of our program today will be on helping older adults and individuals with disabilities navigate the complexities of the health insurance landscape. We'll be introducing you to the SHINE Serving the Health Insurance Needs of Everyone program, offered by the Executive Office of Elder Affairs through our local Aging Service Access Points, or your local Elder Service Agency. I am very pleased to welcome two guests to the program today who have been on the front lines of helping older adults connect with the best information to make the right decisions about their health insurance options. They are here to share their perspectives, their insights, and advice with us today. I am joined by Cindy Phillips, who is the SHINE Program Director at the state level, and Marty Maffeo, who is a SHINE counselor. Welcome to you both.
Thank you.
So I'd like to just start with both of you to share a little bit about your background and your involvement with SHINE. Can we start with you, Cindy?
Sure. Well, I've been in SHINE longer than I'd like to say, more than 20 years, and my background is in social work. And I've worked in a variety of settings, hospitals, visiting nurse associations, aging service access points, or home care. And my interest has been always with the health insurance and with helping people get access to what they need to know about Medicare and their other options.
Thank you. Marty?
And me, I was first at Polaroid for about 25 years and then Fidelity for about 8 or 9. And as I was approaching retirement, I was looking for something that was intellectually challenging, but also beneficial and helpful. And everybody in town knew me by my wife's name because she did everything all around town. So I wanted to reclaim my own name and
of course.
do something decent around the town. But I settled on SHINE and also doing taxes for senior citizens at the Natick Senior Center.
Interesting.
And both of them very interesting.
Yeah, so that led you to the SHINE work.
Yes.
And you know, we hear all the time about the cadre of volunteers across the state who had similar backgrounds as yourself, who want to do something more meaningful, as you described, more intellectually challenging, and dedicate this time in your life to service. So thank you for that. So let's talk out a little bit by what SHINE is and how you would describe it to someone who has never heard the term before, because there's so much acronyms. Cindy and I can relate to this in our world, working in public service. It can be daunting and overwhelming. So how would you describe SHINE to someone, Cindy?
Sure. Well, I think I'd have to say the acronym because that's my job.
Yeah.
So it's serving the health insurance needs of everyone on Medicare, and that it's really a group of professionals and volunteers who learn all about Medicare and how to help people understand what their rights are, what their access points are, how to get the best coverage, how to make choices around covering Medicare and other kinds of things they might need.
Do you have anything you'd like to add to that, Marty?
Just free and unbiased. I mean, you get all these commercials and all these things in the mail. I always get people come in and they have, all the mailings that they've gotten in the last couple of months. And they're all oriented towards buy my stuff.
Exactly. I think that's a really critical point, is the unbiased nature and the approach of the SHINE counselor. Elders and anyone today receive so much information. It's coming over the internet, social media, in the mail, as you described. It's hard to know what's valid, what's not, and how to make a good choice.
Well, there's another dynamic too. It's the seniors who say, my friend has this plan.
Oh,
she
yes.
told me it was the greatest.
Exactly. Absolutely.
Never listen to your friends. The other point I'd like to make too is that it is a national program. Even though we're called SHINE, might be High Cap in New Hampshire or Choices in Connecticut, but it's a national program set up by the federal government to help people navigate through Medicare. So you could really travel from state to state and have assistance if you need it.
So that's very important to know. A lot of support at the federal and state level for this service. So I'm going to start with you, Marty. What exactly is a SHINE counselor?
A SHINE counselor, I mean, the duties that we perform really are to help people navigate and pick their insurance plans, to interface with all the other plans that we have. So it might be state assistance or like MassHealth. It might be drug assistance like Prescription Advantage. It could be employer health plans and which is better and how does that work with Medicare, and also with military. And so I even do some work with the Veterans Affairs Coordinator in the Natick Senior Center.
That's excellent.
And so a typical thing, like right now during annual enrollment, the biggest thing really is drug plans, because those things vary in cost and availability and eligibility across every year. Every couple of months they change, it seems to me anyway.
Right.
And so right now the biggest thing that we do is people come in with, sometimes they bring in a little shopping bag with their drugs, but usually a list or a printout from the drugstore. We calculate the various plans available in their area and pick the cheapest one usually.
So you can go online, I believe it's the Medicare.gov site, and you can plug in the medications that a person is taking, and then it will turn back to you a number of insurance plan options that would best meet their needs.
They also ask for preferred pharmacy, so that you can look at where you could maybe reduce your costs going next door to the other pharmacy or down the street or somewhere else. So there's a few other options there too.
That's excellent. So you mentioned something that I think is very important for our viewers to know, that it is open enrollment time. So what is Medicare open enrollment, and how can a SHINE counselor help an older adult or a person with disabilities navigate the myriad of open enrollment choices?
Well, the simplest definition of open enrollment is it's an annual chance to either change or to keep or to look at your current programs and see if you can either find lower cost or better coverage. And so those are the kinds of things that we try to do. The choices that people have, there's a couple of different types of Medicare, hospitalization, doctors, and drug plans. And so we go through kind of here's what they are, and here's the benefits and the pros and cons. I'd say I get maybe 1 out of 4, 1 out of 5 people is a employee group plan where, like we have a lot of big companies like Raytheon or federal employees and things like that. We try to match up those also.
Excellent.
And so the appointments run out. So what we do is almost every counselor, I think in every region, doubles their appointments for the annual enrollment period. It's October 15th to December 7th. And then we also have in our region anyway, 2 overflow centers where in Needham and in Framingham, people can go there, and we have counselors in there, and they usually in a computer room setting.
Excellent. So Cindy, would you like to add to that a little bit about, I guess I'm curious, and I think it would be important for folks to know, just so that they have it on their radar moving forward, is the dates for open enrollment, does that change every year, or is it pretty much standard
No, I
time?
would like to add a little bit to that. And like Marty said, it is an annual open enrollment, so it is the one time per year when you're assured that it's open for you to get into either Medicare Advantage plan or a Medicare prescription drug plan. And everyone who has a plan currently would have received mail in September telling them about their changes for next year. For example, we know that there were 26 prescription drug plans last year. This year there are 21.
Wow.
That means a couple of them are changing names, a couple of them are terminating, a couple of them are adding or reducing their formularies. So you really do have to be careful and look. People are definitely fixed into this open enrollment period, although we always try to help them out if they need to make a decision outside of the open enrollment period. So we'll look at maybe Prescription Advantage, or whether they're eligible for programs that help them pay for their Part B or D plans, and that would give them more ability to change. Then there's even a Medicare Advantage disenrollment period, January 1st through February 14th, but that's very specific to that group too.
So that's excellent, very helpful information, because I can only imagine if I'm at that point where I'm eligible to receive Medicare and Part D plan, and I've never done it before, getting all this information could be really overwhelming. And making sure that you enroll at the right time and that you don't miss those deadlines can be very important to know. So thank you. So I think you've already talked about the deadline for making those changes to open enrollment. And what are some of the tips that you can offer our viewers on what they need to consider to properly prepare for open enrollment? I can share this with you, Marty. I've shared this with Cindy many times. For my own dad, who also retired from Raytheon, and he gets lots of information every year, and he loves to look at it all and read it all. And even with him being so savvy to go through it all, I always say to him, just let me know what you get, Dad, because I'm going to talk to Cindy so that you make the right choice and that you don't miss those deadlines. So I feel like he has a little bit of an advantage because I can help him prepare. But what are some of the tips that you could give our viewers?
Well, the most important one to me is kind of knowing what you spend and what you have right now. So, bring your Medicare card, or you bring your other additional coverage card, whether it's a MedX or an Advantage plan. Bring your drug plan card. Bring a list of your drugs. Most people don't even realize that you can go to the pharmacy and get a printout of what you've used, what you purchased all year.
Oh, wow.
So if they come in with that, then you're pretty much, I can go through them and say, oh, I can see what the person used for the whole year, ask the right questions. But I'm surprised, actually, that a lot of folks come in, even though they did it for their taxes, but they haven't brought in, when they're doing annual enrollment, a list of what it cost them. So we have very good estimating techniques for, if you buy all these drugs every month as you're supposed to, or every 3 months, we can calculate these things. But it's nice if they have their own accountings, so that you can say, hey, look, this is going to save you $500.
Right.
And so for me, it's really kind of bringing in information about what you currently have.
Good to know. So just thinking about that, Cindy, in terms of those folks who understand and can come prepared, or they may have worked with a SHINE counselor in the past, what are some of the things that the SHINE program or the counselors would do to reach folks who may not know about SHINE, so that they can come to you during this very important time of the year?
Well, a lot of times we will hold presentations, or we'll do shows like this, so that the word gets out more broadly. We actually did send a letter to the Council on Aging newsletters, or a reminder to check your mail. And in fact, when I was doing a presentation recently, one of the SHINE counselors came up to me, who's currently a senior center director, and said that she received a call from the community because of that newsletter from a woman who had not bought Medicare Part B, or hadn't signed up because it was too expensive for her. So when she came in to see the senior center director, who's also a SHINE counselor, the person could not only receive Social Security income, SSI, but also get on to MassHealth, get fuel assistance, have help with transportation, and so many of her needs were met that she didn't even know there was a whole world of things that could help her be more financially secure. So just getting out that little blurb of information in a newsletter was just so important to that person. Not only is she more financially secure, but now she volunteers at the senior center.
Right, that's
so it's a whole change of life for her, just because we're there and because we advertise a little bit.
I think you just hit on a very critical point. And I know from my own experience working with the SHINE program and the other programs that we offer through the Executive Office of Elder Affairs, to ensure that folks know, as Cindy points out, that there are lots of services and supports available. And although SHINE, the counselors are so well trained on a very complex area, many of them have a lot of additional knowledge about fuel assistance or housing or MassHealth, whatever it may be, because there is so much training available beyond the typical SHINE certification training. I know, Cindy, you and your team are out and about all of the time working with the various regional programs and offering these services. So here's another way that folks can learn about what's available to them to keep them healthy and safe and living independent in the community.
And connected to the senior center now, they've got preventive benefits and exercise class and yoga and friendships, and it's just so much more of a fulfillment.
And to add to that, I know over the years as well, this is a program that's primarily been thought of targeting older adults, which it is, but we've done a lot of work with the younger folks with disabilities, because they have questions as well about their insurance options, and there are lots of different options that come down from the federal level as well as the state, and SHINE is also trained in understanding those nuances, correct?
That's right. Yeah. In fact, about 10% of the people we see are younger adults, under 65, and with disabilities. So we certainly, want to help them navigate just like we do anybody with Medicare, and let them know about other benefits like the One Care plans that might be available in their area.
Terrific. I think that's really important to know, just because again, as I said earlier, there's so much information being sent our way through the internet and everywhere. I mean, it's overwhelming. I can't keep up with it all. So I can't imagine that if there is something that was life-changing for me, how I would approach it. So I think it's important for folks who are living with disabilities that they can also access a Shine counselor. One thing I don't know if we covered, this is a free service, right?
Absolutely.
Yes.
Free, comprehensive, unbiased. And while we're talking about people with disabilities, we would love to have more people with disabilities as Shine counselors. So please do call 1-800-243-4636.
You go, girl. You use this opportunity. Always an opportunity to recruit new Shine counselors. So what else is happening that might impact my health insurance or that of my family? Can you provide some examples, Cindy?
Well, I think we've heard, I'm not sure if you've heard this year already, Marty, but the prescription drug costs are really, really high, unexpectedly high. And we're seeing a range with one medication, but with one pharmacy, to be $230 to $700 a month for one person. So it's hugely varying, and to the point that we're wondering if we're seeing the right data, because it's so different. And even to go to one pharmacy versus another, you're saving thousands and thousands of dollars. So you really do have to be vigilant and make sure you're taking the time to look at everything. I mean, the other thing that I think is important is that there are a number of open enrollments right now. People who are MassHealth are being asked to re-enroll. The connector or the marketplace is sending out material and advertising about enrolling again. So we see, just a lot more paperwork and potential confusion.
Yeah, and I've seen all those ads on TV myself, so I can't imagine if you're trying to figure out, okay, where do I go and where do I fit in? So speaking of that, Marty, you talked about the different locations that where Shine is available. Can you talk a little bit about how would, if in my town, in my area, how would I find out where would a Shine counselor be during the day?
The most common place is really at a senior or a community center. They will have different names, and NADIC gets the Senior Community Center, / Community Center. That's the most common, but there are lots of other places, and sometimes just in the town offices. I think in Hudson, a couple of the social workers are also Shine counselors, and they can cover that whole spectrum, as we've been talking about, fuel assistance and all those things, including medical care. And so senior center is always the best bet because frequently they have a contact there already. But 1-800-AGE-INFO is the number we always give out, and there's 2 numbers you can press: 3 if you're on a landline, 5 on a cell phone.
Okay.
And they'll tell you, you'll get a call back, and they'll tell you where to go, and have somebody call you back.
So is it critical that I make an appointment, or can I just visit my senior center?
At this time of year, actually in NADIC we do it all appointments. And,
because you're so busy?
If there's an urgent kind of request, what we'll do is we'll call them and try and work it offline. But pretty much it's appointment only, because it takes, half hour, an hour to just gather the data and present a conclusion.
And have that conversation.
It'd be pretty hard to have a walk-in environment for that.
Well, that's very important to know. So you both have wonderful stories of how communities and individuals have benefited from Shine program. Any other stories that you can illustrate that have impacted the program, or some success stories?
Well, for me, I had a fellow who came in last year, and he was, my drugs are too high, my company canceled my coverage. And so this is part of, I think, what the Shine counselor has to do. You have to interview the folks and kind of drag out information, and you're just making small talk, and it turns out to be significant. Your company canceled your plan. Where'd you, how'd that happen? He says, I don't know, I just went in, I gave him my card, and they said, this is no good anymore. And so I said, well, what'd you do? And he worked for a utility company, which typically has very good benefits, especially the older fellas older folks who've retired. And so we started tracking down what his old company was, and of course there've been a couple of mergers and Googling and calling, and they're wrong numbers and all that. But we finally found the right center for this fellow, and I said, I want to check this person's coverage. Oh, he's active. What they did was they had changed the plan, the carriers for their insurance, and he didn't realize that, even though they had sent him a new card. He's given the old card. They say it's no good.
I bet that happens all the time.
So he spent 2 years of $2,000 on prescription drugs.
Oh my goodness.
And the plan reimbursed them.
Now that's a
good
story.
story.
That's a really good story.
Incredible. And so I got a good new friend.
Good, yeah, I bet you do.
Another one,
That's
a
wonderful.
favorite one of mine, is a 104-year-old woman who lives alone in Natick, and somehow or other she found me. She can't get out, so we do a home visit, and they get a person from the senior center to come also. And this year she fell, and her family found her notes, and they were so perfect from the last couple of years about this diligent, here's what I take, and here's my prescription number, and here's all that. And so she was in a hospital, in a rehab, and I was able to do her drug plan. We saved her $300, and
That's fantastic. Loved hearing those great
and
stories.
I did one other one that I thought was kind of different for me, and it was a woman who was born in 1968, so younger, and going blind suddenly. Had a good job and a career, and then 2 years ago she started to lose her vision. Now she's on disability, and after 2 years, MassHealth puts you onto Medicare. And so the change for her was very confusing. One, just to even read the literature, know what the times were, figure out her options, and all the rest of that. And the Shine counselors, work pretty well with the MassHealth folks and all the rest of that. And so really I was kind of a facilitator, not that anything was super complicated, but there's lots of steps involved. What's your drug plan, how does Medicare know that you're now entitled to, lower cost drugs and prescriptions, and how does MassHealth send that over to Medicare? So we just got her all set up, and she started her coverage on the 1st.
Fantastic. Love hearing those good things. So you've already talked a little bit about what prompted you to be a Shine counselor, but how long have you been doing this work?
2009.
Excellent. And we are so fortunate to have you part of
it's
the
a pleasure
Shine
for
program.
Me,
Excellent. So I have some knowledge about what it's like to become a Shine counselor in terms of the training, but I'm sure there are viewers out there who would like to know more about how do you become a Shine counselor, where would I find out about becoming a Shine counselor, and what is the training like?
Okay. Well, I think Marty already gave the phone number. We use that 1-800-AGENT phone number for everything. Contact a regional program using the 1-800 number and ask about the next training coming up because you're interested. So the training is generally every spring in every region of the state, and it lasts about 10 days. The schedule can vary. It could be twice a week, it could be once a week, depending on who's coming in for the training. And it's really important to us that we not only go through all of the Medicare information, Medigap, HMO, drug coverage, public benefits, maybe long-term care insurance, veterans, et cetera, but also have quizzes and do case studies so that we really can implement some of the work. Then we make sure that people also are set up with a mentor so that they can learn from the mentor, shadow, and really feel more comfortable with the information. So that's really the best way, is to call that 1-800 number and see what opportunities might be available.
So I imagine that the training can be intense in terms of the subject matter for obvious reasons. Are there ways to participate in a refresher course, or as you mentioned, there are mentors, or is there some supervisory role where the Shine counselor can go to if there's a question that comes across there during their counseling session and they're not sure about that?
Sure, we're pretty much well set up to have people who are veterans as Shine counselors assist those who are new to the program coming into the area. Each regional office has a regional director and usually an assistant director or somebody who also is there. I don't know about Kathy, but I think it's true that they all give off their cell phone numbers so that you can call them as needed.
Wow.
They're very accessible. And we really have an open door policy. In fact, I've talked to many counselors too who's had questions. We, go over the information every month. We pretty much have monthly meetings so that we can go through it, we can handle problems, talk together about cases. Communication is really critical. We don't want anybody to feel like they need to be overwhelmed by the information. We're there for you, and we're there to help people learn, as a group.
Exactly.
Right.
So the program is statewide. There's a little over 700 Shine volunteers today.
Right, and in fact, some of them work in agencies. Just to mention that they might work at housing. Some of the resident advisors are Shine counselors. You also have people in hospitals and veteran service officers. We work very closely with the veterans, like you mentioned too.
Yeah, and that's been a relationship that's been strongly cultivated over the last few years.
That's right.
That's That's fantastic because that's a whole separate health insurance delivery system and very complex. And I think it's really important for our viewers and anyone out there who is a veteran to understand that certainly you have your local veterans agent and the VA to go to if you have questions, but accessing a Shine counselor can be extremely beneficial to understand sort of where there might be other areas where you can tap into and not just that VA benefit.
In fact, depending on your course of illness, you could go through Medicare for some help versus the VA. Like if the closest hospital for cancer treatment is down the street and your VA center is 50 miles away, you know, you might want to choose to use your Medicare benefit instead of VA for certain services. And that's something we could help people learn about too.
That's excellent. So Marty, in your experience, because you know we know that this program is primarily has in the past focused on Medicare, and we've talked a little bit about other public benefits, but do you do a good amount of counseling for folks around understanding MassHealth options as well?
Yeah, I think it's just inevitable. We screen every single person that comes in either a very explicit way, like, you know, let me show you some income numbers and you tell me where you fit, or, you know, well, if you have a pension and you have another thing, or if you're still working, and, you know, you can kind of screen out without being super direct. But really, we screen and record just a little check mark on the thing about whether we think they're eligible for public benefits or not. And if we do think they are, then we start to pursue a little more. What I do is I show a little chart that just says, you know, let me show you this. If you're somewhere in here, we could, you know, keep working on this issue and see where we get to. So, in my view, we screen everybody that comes in for public benefits.
That's terrific. That's really
And then I
important
work next to the social workers. So if I see that there's some eligibility for MassHealth, we start down the, hey, have you talked to the folks next door? And, you know,
That's excellent.
It's a great handoff.
Yeah, terrific. It's collaboration and really tapping into the expertise around us to best serve that individual who needs assistance. So one of the things, I'm mindful of the time, and I want to make sure our viewers really get a good sense of what is available to them through Shine, but one of the areas we didn't touch upon, and if we could just touch upon it, is around accessibility and any cultural barriers and access to language, because again, we're talking about this as a statewide program, and there are areas of the Commonwealth where there are some languages more prominent than others that are not necessarily English. So I guess I'll start with you, Cindy.
Speak to that a little bit. We have hired at the state level a project coordinator who is very bilingual in Spanish, and she takes a lot of calls by phone and helps support our Spanish and bilingual counselors throughout the Commonwealth, whether in Lawrence or Worcester or Springfield or Boston, and that's been a wonderful resource. We also set up trainings for groups of bilingual counselors or staff people, like we're going out to Latino Health Insurance Company in Framingham, for example, just to sit down with the staff and do a training and make sure they all understand what's happening this year. So it's a very collaborative relationship, and we also have about 77 bilingual counselors throughout the state. Currently always looking for people to represent the community and new groups of people who might be moving in, or you know, Portuguese people in New Bedford, for example, and Framingham and other spots. So, you know, we certainly are interested in more Portuguese counselors and others. We have access to a language translation line if we ever need that, and also services for the deaf or hard of hearing, and visual acuity. Also.
That's fantastic. So it's very accessible to all folks, all individuals, all language backgrounds and abilities.
Right. And the other thing I just want to mention too is we didn't talk too much about pre-retirees.
Yes. And
you know, you talked about employer and benefits. A lot of people will come to us because they're offered a certain package. We've seen a number of companies change their packages. Retiree or, you know, while they're working, and it's confusing. You know, the choices are limited, or the drug plans look like they're the same drug plans as ours, but they're a little bit different. So we could just help them walk through all of that.
Well, I really want to thank both of you today. It's been such a pleasure. Thank you, Marty, for taking the time out of your busy schedule, especially this time of the year during open enrollment. And in closing, I'd like to remind you, our viewers, how to take the next step. Call your local senior center to get a Shine appointment during open enrollment, or call 1-800-AGE-INFO. That's 1-800-243-4636. Then press or say 3. This is a pleasure and a wealth of very important information for folks to know. The work that you do is so inspiring and important, so thank you. And to our viewers, it's been a pleasure to be with you all here today on Senior Scene.